We will talk about acne. Acne is a very common condition. It affects around 85% of young people at some degree. So acne is a very common condition. Acne is characterized by pimples, which we call comedones, and comedones can be whiteheads or blackheads. So most important characteristic of acne is comedones. And how these comedones are created. First we have normal hair follicle. You can see it's hair follicle, and we have some small muscle here, and we have here oil gland, which we call sebaceous gland, and this oil gland produces oil. If this oil gland creates excess oil, it can clog these pores. Then dead skin cells will add it. It's natural process. Our skin cells die and newer cells are created, and these dead cells are mixed in this oil and clogged further, and it creates a comfortable area for bacteria, and bacteria also grow here, and we get black comedones. These black comedones are black because this oil directly have contact to air, and there is oxidative reactions, and this oxidation creates blackhead or open comedones. In case of whiteheads or closed comedones, process is same, but this pimple is closed. It means it has head, and we have white substance under it. It's usually bacteria, leukocytes, and of course oil, and it creates whiteheads. And usually it also causes inflammation, and inflammation causes redness and sometimes discomfort, sometimes pain. It's a mechanism of acne formation. Typical locations of acne is face, forehead, chest, and upper back and arms. These places are important because oil gland or sebaceous glands are presented here excessively. That's why when person has oily skin, this person will develop acne on such places. And bacteria which is involved in this process is Propionibacterium acne. It's important because this bacteria causes infection, inflammation, and important pain sometimes, and important discomfort, visual and personal discomfort also. Acne has 4 stages of severity, from very mild to severe, and severe forms is especially difficult for people. That's why they try to seek medical treatment. Testosterone, which is sex hormone, affects acne formation. That's why it's common among teens. When testosterone level is up at this stage, we have acne in almost any young person at some degree. And there's important question if acne is hereditary. Yes, it's hereditary. It's strongly genetic. It means if parent has acne, his kid, his children also will have acne. There's high probability that his or her children will have acne also. Another question is if food can cause acne. It's complex, but there is some correlation, and correlation is like this. The food which contains sugar, which contains simple carbohydrates, they increase risk of acne. And why it happens? Because sugar stimulates glucose level up in the blood, glucose spikes. It causes insulin level up also, insulin-like growth factor also level up, and insulin and insulin-like growth factor causes production of excess oil, excessive oil on the skin, and it causes acne. So carbohydrates and simple sugars like white breads, bakery products, cakes, most fast foods, and potato and chocolate cause acne or exacerbate acne. Also, milk products sometimes causes acne also. Why? Because if cow is pregnant, her milk contains hormones like progesterone and insulin-like growth factor, and when you drink milk which contains insulin-like growth factor, it can cause acne also, because it increases production of oil or sebum. It is called sebum from sebaceous glands. So oil is important, and milk also can exacerbate acne. Also other dairy products including cheese, for example, and yogurt, but correlation with yogurt is low, but milk can flare up acne. It's important. Now let's say about most important part. It's treatment. What treatment we have, what is most effective treatment, what is first line treatment, what is safest treatment. Benzoyl peroxide is first line treatment. It comes with different forms. It can be gel or cream or lotion, and benzoyl peroxide is first line treatment because it's safe and it's effective in case of mild and moderate acne. It kills bacteria, reduces inflammation, and improves skin cell turnovers. So benzoyl peroxide is safest treatment of acne. It comes with different concentrations, for example from 2.5 to 10% concentration. What is difference here? Difference is strength. The lower concentration, it's safer, it irritates skin, less likely to irritate skin, and concentration with 10% can dry skin, can irritate skin. That's why concentration is important. But of course, this 10% concentration is much more potent compared to 2.5%. So benzoyl peroxide is considered first line treatment of acne, and it's considered one of the most safest treatment of acne. Second, which is still first line treatment, is retinoids. For example, tretinoin is very common. Adapalene also common representation of retinoids. They are very effective. So retinoids is considered most effective treatment of acne, while benzoyl peroxide is considered safest. Retinoids considered most effective, especially local or topical retinoids. They have effect in 4 to 6 weeks of treatment. At first stage they can flare up acne, and you should be prepared for it, so they can increase acne at first stage, at first days, and after this acne will improve, and important result will be in 4 to 6 weeks. Main mechanism of retinoids is unclogging pores, prevent new breakouts, and promote skin cell turnover. That's most important mechanism of how retinoids works. Retinoids are vitamin A derivatives, and they are very effective. They are also effective in case of regular use, but they have some side effects also, for example dryness of skin or redness and irritation of skin. That's why moisturizing agents are advised at this case also. And retinoids comes also in different forms, for example gels, creams and lotions. Gels usually are alcohol based, and gels are strongest, and gels usually more effective against oily skin. If person has oily skin, then gels are better. If person has dry skin, then creams are better because creams moisturizing effect. So creams are for dry skins, and lotions are weaker, and lotions are lighter versions of creams, and lotions have advantage that you can spread it on large area. So most common side effects of retinoids is redness of skin, dryness, and irritation of skin. They should not be used during pregnancy because they have teratogenic effect. And clindamycin and erythromycin are also topical antibiotics which are used for treat acne, because to kill this propionibacterium acne, which is bacteria inside acne. And in many cases doctors prescribe combination of these medications like benzoyl peroxide, retinoids, and topical antibiotics. If this treatment is not effective, then we have oral isotretinoin, which is strongest and most effective treatment of acne. But it's oral, it means it has systemic action. It's very potent medication. Usually it is prescribed as a solitary or it is prescribed without any combination. Only this medication is prescribed usually because it's very potent. It can have some side effects. That's why it requires medical attention also, because it can worsen liver function and it can cause increase of liver enzymes. That's why you should control your liver enzyme if you intake isotretinoin. It's very important. Also you should check your lipid spectrum, also lipid levels. And isotretinoin is not used in pregnancy. It's very strict recommendation because it has teratogenic effect. Also, it's recommended that not to use isotretinoin with other medications, especially with antibiotics like tetracycline, because it can increase intracranial pressure and cause intracranial hypertension. We also have some other medications like salicylic acid, for example, or sulfur also. They are usually creams, sometimes lotions, it depends. They come with different forms, and for example salicylic acid increase it has keratolytic effect, keratolytic properties. It has some effectiveness, but it's not as potent as retinoids, and of course it's not as potent as isotretinoin. Also sulfur removes dead skin cells and clog pores also. It's important also, but first line treatment and most effective treatments are considered benzoyl peroxide and retinoids, and sometimes antibiotics also are prescribed. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.